Hello, I'm Linda Ehlers, and I'm a chiropractic physician. Has fibromyalgia left you feeling hopeless? If so, then listen to this. Here are my top 10 reasons why you continue to struggle with fibromyalgia and what your doctor is doing wrong. Number 1 on my list is autoimmunity. When someone walks through the doors of my clinic, my evaluation has the same priority of issues to be considered and ruled out, and here they are. Number 1, autoimmunity problems. Number 2, blood sugar imbalances. Number 3, anemia, either iron or vitamin deficient anemia. Number 4, gut and liver abnormal functions. And number 5, fatty acid abnormal metabolisms. But autoimmunity is at the top of the list because it trumps everything else. When your own immune system goes out of control, it launches attacks on your own body's tissues. Fibromyalgia is often left out of the list of autoimmune diagnoses. And now remember that a diagnosis is just simply, it's a label, and labels are great for cans, but not for people. So frankly, I'm glad it's left off the list. The medical world's answer for autoimmune conditions is steroids. And if fibromyalgia were on that list, they would do an even poorer job of managing it. So a majority of the patients that I see with fibro have an underlying autoimmune condition. The immune system most commonly will attack either the thyroid, which causes blood sugar imbalances, or your adrenal glands, which will perpetuate the chronic fatigue that you have, or the brain, which creates the fibrofog. And until you run the right tests to know that one of these or all of these are the problems, you cannot have all the information to help you get better the fastest. Number 2 mistake is they tell you it's in your head. How many doctors have you seen that have told you that it is in your head? This directly translates into, I don't know how to help you, get out of my office. All of your lab tests are normal. All of the imaging you've had is normal. And a few of you may even have seen white spots on your brain MRI. And if this is the case, I refer you to number 1 on our countdown here today. Your condition is actually in your head. The problem is that it is everywhere else too. And your doctor is only as good as the drugs he or she prescribes. Fibromyalgia is a metabolic condition. You cannot drug your way out of a metabolic condition. Number 3 on my list is they've ordered the wrong tests. I see this every day in my office. Some unfortunate individual will drag themselves into the office with stacks of blood work that they've wasted hundreds, if not thousands of dollars on. The tests are usually a complete blood chemistry, a chemical panel, and a TSH. They may have also had ordered a group of tests ruling out autoimmune diseases called HLA-B27s. Why? Why are these tests done? Because these are the tests that your insurance will pay for. But that's not enough information to get you better. What about immune panels? What about your thyroid studies, true in-depth thyroid studies? What about your adrenals? And what about food sensitivities? All of these may be making your condition worse. And if we cannot make a sound clinical judgment without that kind of data. 4 on this list, the right tests were ordered, but they got the wrong results. What? Medical doctors use lab ranges as a guide to determine whether or not you have had a particular disease. The easiest to use as an example here is TSH, which is thyroid stimulating hormone, a chemical from the brain. TSH is used to determine whether or not you have a thyroid condition. So traditional medicine uses the lab ranges of 0.5 to 5.5. In other words, if your TSH level is below 0.5, you have hyperthyroidism. If it's above 5.6, you have hypothyroidism. However, in order to have the healthiest maximum thyroid function, your levels must be between 1.8 and 3.0. You can see that this is a much narrower range. You can be completely hypothyroid with a lab value of 3.5, yet your doctor says it is a normal test. I use functional ranges as well as lab ranges when we evaluate a patient. Number 5, medicate, medicate, medicate. Fibromyalgia is a neurological condition caused by a breakdown in your metabolism. It's a metabolic condition. You cannot drug your way out of a metabolic condition. Drugs will help with your symptoms temporarily, but they'll eventually make you worse because of the damage they do to your kidneys and liver. Do you really want to continue to gamble with them? Number 6 on my list, no diet changes. Most doctors don't know squat about nutrition. If you go to your doctor and ask him or her about gluten, for example, they'll run a celiac test on you. That's a very inaccurate test. And then they'll say you don't have celiac disease, so eat whatever you want. Fact is, your condition is more than likely being caused by what you put in your mouth. The standard American diet, we happily call it the SAD diet, is causing so much stress on your body that it is causing you to be sick. Number 7 on my list, taking too many supplements. Yeah, I said it. Taking too many supplements can make your condition worse. If your fibromyalgia is caused by an autoimmune condition, which is your own body's immune system, and it's supposed to keep you from getting sick, if that immune system actually attacks your own tissues, it will make you sick. Then taking supplements can actually trigger an autoimmune reaction and make your condition worse. Number 8. What about the thyroid? Thyroid disease is often overlooked in fibromyalgia. If it is assessed, 99% of the time it's mismanaged. Every cell in your body has a thyroid receptor. When the thyroid slows down because of an autoimmune attack, every system in your body slows down. You may have fibromyalgia symptoms because of an autoimmune attack on your thyroid. Number 9. It is reversible. All too often in the medical world, the doctor will diagnose a patient with fibromyalgia, if the doctor even believes in it, and then will say, well, Mrs. Jones, there's nothing we can do. You're going to have to live with it. And then they write a prescription for Lyrica and an antidepressant and send you on your way. This is not the answer. I've spent the last 30 years in Illinois helping people overcome the icy grips of fibromyalgia. If you treat it correctly and make the correct lifestyle changes, it is reversible. And last but not least, number 10. The condition is real. I really don't care what other health care professionals have told you. Fibromyalgia is real. It is not in your head. Well, it is. It is a neurodegenerative disorder, so yeah, it's in your brain. It is a very real disease that's destroying millions of lives across the country. It is real. I have seen the devastating effects it has, but it is reversible. I want to help. Understand that I do not accept all cases, only those cases that I truly feel I can help. My protocol for accepting a new fibromyalgia patient is basically a 2-step process. The first step is to have a one-on-one direct consultation and perform an examination with the individual, during which I make sure that they have been thoroughly examined for any neurologic issues as well as metabolic. Once I have all the historical and physical data, then I will sit down and review all of that information. I make sure that they have had the correct laboratory studies. On their second visit, I'll tell them what I found and what I think is the best plan of action to restore their health. If you would like to schedule your 2-step consultation and recommended action plan with me, call my office 708-598-9010 and speak with my staff. Be sure to mention to them that you already know the 10 most common mistakes doctors make when they attempt to help a fibromyalgia patient. Thank you for taking your time today to listen to this message about 10 mistakes doctors make. Thank you again.